to perform an enema, I would come in the patient's room, perform hand hygiene, and identify the patient. I would then close the door or the curtain. I would gather together all of my supplies in one area, and I would make sure that the tubing for the enema is clamped. I would then take my enema to the bathroom and fill the bag with between 750 and 1,000 milliliters of water, depending on the provider's order. And I would check the temperature of the water on my inner wrist to make sure it was the correct temperature. I would then add soap and squeeze the bag instead of shaking it so that the suds will not build up in the bag. I will then take the tube and I will unclamp it and then reclamp it when the water runs down so that there's no air in the tube. I will then return to the patient and put them in a left side lying Sims position with their right knee flexed. I will cover them with a bath blanket and just expose their buttocks, and I will don my gloves and put an absorbent pad underneath the patient's buttocks. I will then uncap the enema and I will apply lubricant to 2 to 3 inches of the enema. I will then spread the patient's buttocks to visualize the anus, and I will ask the patient to take deep breaths as I insert the enema towards the umbilicus between 3 and 4 inches in. I will then hold the tube while unclamping it, and I will hold the bag around 18 inches above the anus in order to get the flow started. From here, I can clamp the tube to completely stop the flow, or I can lower it to slow it and raise it to hasten the flow. And once the infusion is complete, I would reclamp the tube. I would ask the patient to squeeze their buttocks together for several minutes after removing the tube, and I would ask them to try to retain as much of the solution as possible to help it to work. And then I would check the characteristics of the feces and the solution. I would then get rid of the enema, and I would document the procedure, the amount of solution used, the results of the enema, as well as how the patient tolerated.